We are Americans. We're generous people, and we solve problems. If we see suffering, we try to alleviate it. If there's a natural disaster somewhere in the world, we mobilize to send aid. And when fellow Americans can't afford health care, we want to help them. We've got a program for that, Medicaid. The program was established in the 1960s to provide health care for the poor and vulnerable. It's become an important safety net for a wide variety of people and needs: long-term senior care, the disabled, children of the working poor, and many others. But we have a problem that we've got to face. Medicaid has grown drastically, especially in the last decade, by 64%. Medicaid covers more Americans than Medicare does. One reason it has grown so much is that the program has expanded beyond the poor into the middle class. Medicaid actually provides health care funding to more Americans above the poverty line than below it. Medicaid is about to expand even more, thanks to the President's health care law. Currently, about 56 million people are covered by Medicaid. By 2020, it will cover almost 83 million people. But Medicaid is already busting state budgets. It's projected to grow 7.2% annually, while revenues will grow by only 3.9%. Where are we going to get the money to pay for this? At this rate, Medicaid will crowd out spending on other essential services like education, law enforcement, and infrastructure. While Medicaid costs surge, recipients are having another problem: finding doctors who will see them. More than 30% of primary care doctors and specialists will not accept new Medicaid patients, according to a recent study. Most of the time, doctors incur a loss when they see Medicaid patients. One doctor even said it would be cheaper to treat Medicaid patients for free than it is to apply for Medicaid reimbursements. That's not fair to doctors, and it's not fair to the most vulnerable members of our society who rely on this program. And the way Medicaid is structured, there are greater incentives to promote expensive institutional care instead of disease prevention and management. So we're spending more money, but we aren't buying better health. That's not right. Unsustainable expansion of an already broken system threatens Medicaid's ability to do what it was set up to do: serve the poor and the vulnerable. As President Obama says, poor children, grandparents, kids with autism and Down syndrome and other disabilities, quote, "These are the people who count on Medicaid." We need to reform Medicaid so they can continue to count on it. Because if we overwhelm the system, we're not able to provide help for anyone. We need to construct a Medicaid health system that delivers essential health services and better outcomes while responsibly managing costs. Reforming a public assistance program of any kind usually meets with stiff resistance, especially from those who receive a large part of their income from federal spending. Medicaid is a significant revenue source for hospitals, nursing homes, and personal care providers. It pays for 40% of long-term and nursing home care for seniors, and for 40% of births. Many governors have complained that they could improve services and save money if only Washington would give them more flexibility. Our idea for reforming Medicare is for the federal government to return Medicaid dollars to the individual states and empower them to develop their own plans. After all, different states have different needs. Some may want to expand community health care centers in which a person can be assigned a health and life coach who not only treats symptoms, but also helps the person develop a healthy lifestyle so as to diminish the prospects for increasing health problems. Other states may want to encourage volunteerism on the part of doctors and give them a tax break for doing so. Some states may want to move from a fee-for-service plan to subsidized health insurance and health savings accounts. Other states will develop other plans. By empowering states to creatively customize their systems as they see fit, Medicaid can be made more personal and promote improved health outcomes. This should be our focus. A few states, such as Rhode Island, Indiana, and Florida, have obtained certain waivers from the federal government in order to reform their Medicaid programs. They've had success both in improved outcomes and controlled costs. Rhode Island has slowed its growth in Medicaid spending while providing more efficient and more coordinated care. Indiana's health care plans for uninsured low-income residents also have improved quality of care. 94% of participants have expressed satisfaction with the program. Florida has been piloting a Medicaid overhaul in 5 major counties for over 6 years. Recipients can choose among different insurance plans and can receive cash incentives for healthy behavior, like quitting smoking. The state has saved $118 million a year with improved health outcomes and 83% higher satisfaction rates for those in the program. When the program is implemented statewide, Florida expects to save almost $1 billion a year. Giving states flexibility works. We should be striving to replicate these results across the country. Let's do what's right for all Americans by producing Medicaid reform that controls costs while it coordinates care and improves access to physicians. Let's put American compassion and ingenuity to work to improve Medicaid. Thank you.